Lev from the Business Council, Ed from the Retired Public Employees Association, thank you both for being here.
Thanks for having me.
Of course. So we're talking about the New York Health Act, single-payer health care in New York. It's a big idea the Democrats in the legislature are trying to push through before the end of this year's legislative session. It would basically create a whole new healthcare system for New York called single-payer. And I'm not going to get into the details of that. I just want to talk about this bill. Lev, I want to start with you. Business groups have said that this bill may cause some economic concerns for the state and may actually be bad for New York's bottom line. Can you explain where you're coming from here?
Yeah, sure. It's, I think, an understatement to say it might be bad for New York State. It might be bad for the business climate. It might be bad for the economy. There's been a lot of studies. The price range of this package runs anywhere from over $100 billion a year to $250 billion annually. There's a projected job loss in the state of New York of 161,000 jobs immediately at the inception or the enactment of the bill to become law. It would completely change a number of things, including tax structure. It would put a 10% payroll tax across the board, 80% of that paid by employers, 20% of that paid by employees. So you would see your average employee have an increase in their taxes of, just payroll taxes, on the low end of 18%, and that would be for low earners. It would be, I think it would not be hyperbolic to say that it would be an economic disaster in the state of New York.
So when we talk about single payer, something that a lot of people bring up is, well, it's going to cost a lot of money, obviously, but will that outweigh what we are already paying in health premiums? Has there been any analysis on that in terms of the New York Health Act? Would it cost more than people are already paying out of pocket for insurance right now?
Sure. It really obviously is going to depend on who you ask, and it's going to depend individually. But and you can always find folks who are going to have a different experience. But by and large, you're shifting from premium to taxation with no cap on the taxation. There's very little question that it's going to cost many much, much more. And just to give an example, a couple examples. One would be if you happen to be a lower earner, you're currently not paying into the tax system as much, and you may be taking part in a Medicaid program, or you may be taking part in one of the other programs that are both state and federally funded where you're getting a very low cost coverage. That's going to go away. You're going to start paying this 18% tax increase that I mentioned a moment ago. So for that person, it certainly would be a very big deal. For the employer, on the other hand, you're paying whatever you're paying in premium. You're going to be supplanting that with an 80% of this 10% overall tax. If you remember back maybe 10 years ago when we were discussing the ACA, Obamacare, and one of the things we kept hearing, the mantra out of Washington was, if you like your plan, you can keep your plan.
Right.
This plan makes all plans in New York illegal except this. So the absolute mantra here is, if you like your plan, too bad, it's gone.
So you would be forced to go onto this. You can't keep your plan.
It would be illegal to sell any other insurance product covering these things in the state of New York.
So that's a good segue to Ed. The Retired Public Employees Association has a position that we don't really know what's going to happen to the benefits of retired public employees under this legislation, or maybe we do. Can you explain your position?
Certainly. Retired public employees have spent their whole career waiting for this moment.
Building toward that benefit.
To enjoy the benefits that they've earned. There's a provision in this bill that talks about lessening benefits, which is quite alarming. Specifically, it says if in fact this new plan, this New York Health Act, diminishes your benefits, that you would go back to where you used to be to get your benefits from that program.
So
and as Lev just said, that program no longer exists.
So would it be that you don't have as much coverage? Like, do we know how the plans would change? Is it that certain things wouldn't be covered anymore? Would any costs go up for retired public employees?
Well, we don't know. That's the uncertainty. They're asking us to believe that if we go into this new plan, that everything will be better. Specifically also for you could be a retired public employee who no longer lives in the state of New York, which means that you are getting benefits. Either one, you're on Medicare, which a lot of our members are, or two, you have a supplemental plan maybe from your local jurisdiction, your municipality or your county. But that would have been based in New York, and those plans would no longer exist.
It's tough. I couldn't imagine being a retired public employee and being uncertain about that. Hopefully we can get some clarification from the bill sponsors as to actually how this is all going to work for them. But I do want to circle back to the jobs question with you, Lev. You'd mentioned that the state would lose 160,000 jobs if this went into law. Can you describe what jobs we're talking about here? Are we just talking about jobs in the health insurance industry? I guess who are we looking at in terms of who would no longer be employed?
Well, of course, you'd be talking about jobs in the health insurance industry because they would cease to exist. But you'd also be talking about jobs in the producer community or the broker community, people that make those connections. And then, it sort of moves out from there. There's all kinds of ancillary businesses that rely on those businesses, quite frankly, to exist. So it goes down to even as much as the luncheonette, down the road from the facility where 1,000 people might be losing their job. And it's not concentrated actually in one area of the state. There's really large job losses on Long Island, certainly in New York City, all the way up the Hudson Valley, and then throughout the I-90 corridor. So the pain would be felt really sort of across the board. So I think 161,000 is the number that we're talking about when the bill is enacted, when it goes into effect, rather than sort of what the long-term impact of this bill could be, which could be much worse.
So we're almost out of time. I have one closing question for both of you, because I think that everybody can agree that healthcare in New York and across the country is too expensive, and health insurance is unaffordable for a lot of people. From both of your perspectives, and I'll start with you first, Ed, how, if not the New York Health Act, can we lower the cost of healthcare and health insurance in New York?
Well, I'm not an expert on lowering the cost, but I can tell you this, that most people like the insurance they have. Now, let me just add one thing that's really scary. If the state were to take over all the health care, and we saw what happened, seniors, retirees who were in the first wave of people trying to get vaccinated, it was a disaster. And it was horrible. And the process was unworkable.
Very disorganized.
Especially for seniors.
Yes.
Who are not computer literate, who needed help. And going into this brave new world, I don't think is the way to go.
Lev, go ahead.
So I think that Ed is right. I mean, we have a problem. The problem is that we have 95% coverage in the state of New York. We have to close this small gap, and there are a lot of ways we can do it. But as far as controlling costs of healthcare, there are a slew of things that could be done. I think that we should start maybe at taking a look at some malpractice reform, looking at things that are driving up the cost, unnecessary testing, what we would call defensive medicine. And when it comes to plan design, plans are really, they have to choose from a very, very narrow sort of field of plans. There was a time where you could have a more robust choice of plans, one that was more narrowly tailored to sort of your needs. All of those things can be done one at a time or together in more of a unibus package without doing something so unbelievably extreme and creating a health plan that's honestly more draconian than any in the world, with the exception of perhaps Cuba and Belarus.
It's a really interesting conversation, and I think it's one that we're going to continue having for, I don't know, in perpetuity until everybody's happy with what they're paying for health insurance and what they're getting for health insurance. But we got to leave it there. Lev Ginsberg from the Business Council, Ed Farrell from the Retired Public Employees Association. Thank you both so much.
Thank you.
Thank you. My pleasure.